Welcome back. You're still watching The Globe. The International Conference on AIDS and Sexually Transmitted Infections in Africa has wrapped up a week-long meeting in Durban. Delegates discussed the impact of COVID-19 on the HIV-AIDS response and to share lessons from African countries on overcoming the barriers for testing and treatment. Addressing the opening ceremony of the International Conference on AIDS and STIs in Africa, Executive Director for the Joint United Nations Programme on HIV-AIDS, Winnie Byanyima, says that Africa could see close to 5 million deaths from HIV-AIDS in the next 10 years if the critical challenges of inequality and slow access to treatment are not addressed. The Pan-African meeting brought together scientists, healthcare workers, people living with HIV and government leaders. Now, to wrap the International Conference on AIDS and STIs in Africa, which, as we've just said, concluded this morning, we're now joined via Zoom by Doctor Fikile Ndlovu, who's the ICASA Local Organizing Committee Co-Chairperson. Thanks very much indeed for joining us and welcome to the program.
Good morning, Peter, and good evening to the listeners.
I can see it's been a long conference.
Very long.
All right. So we knew what you wanted to talk about, given the theme going into the conference. Would you say that you were able to properly ventilate the issue and really look at the COVID-19 response to HIV and AIDS treatment?
I think the conference really afforded us an opportunity to be able to discuss the HIV, TB, and STI in the midst of the COVID-19 pandemic, and therefore these pandemics that needs to be dealt with. It definitely allowed us that opportunity.
So what were some of the thoughts that were coming through and, you know, experiences that have been shared across the continent with the challenges that you were facing? I know that at the beginning of this, we spoke about access to medication and that kind of thing. What kind of things is Africa generally facing in terms of, let's start with HIV before we get to the STIs?
I think obviously Africa was really on a path, including South Africa, of really trying to achieve the targets in terms of the HIV targets, our 90-90-90. And whilst we're on that path and we're still struggling in some areas like prevention, and we were clear that especially for our young people, then the pandemic hit us. And I think that is seen across Africa, where the issues of us now regressing in terms of those targets and the struggles that are similar, both in South Africa and in Africa, around trying to respond to HIV in the midst. Obviously, we'll all understand that the pandemic came with its own challenges of lockdowns, infections, access to healthcare. So that is something that was clear and that we all faced.
So what then, the response? Because I guess this is where you were trying to get to. Definitely,
and I think the first thing was the experiences of other countries sharing some of the innovations so that they came up with around trying to respond. And I think at the core of it is issues that we've already spoken. We had already known them in the space of HIV around the community system strengthening, the role of communities with the pandemic, the issue of decentralization, and I think became strong. Where you don't want to get people, obviously, the access. So you want to make sure that people can access their medication in the most decentralized manner. The issue of innovation and also looking at digitalization, the scheduling of people. Remember, with the COVID, you can't have people coming in from an access to health. But also now the issue of saying, how do you reach people on the ground? That is why the role of community system strengthening became a core. I do want, though, to say some of those issues were issues that the pandemic of HIV had already taught us. We were disrupted by COVID, but it's coming out clear that those things that we had thought should work in our HIV space are the same ones that we need in the midst of the COVID, with innovations that would come in to ensure that obviously you start to look at saying, how do you decentralize? We were already decentralizing, Peter. If you think about our CCMDD programs, if you think about driving our programs on the ground, ensuring that our communities are the ones who drive messages of behavior. So I think it was that reinforcement on saying, let's refocus back with some of the innovations that came out. And that's what you find in the rest of the countries. But we are clear, the impact was big. We could see that we lost patients, we lost people, the new infections that are there. So it's just refocusing and saying, now let's get back to the work.
You had set quite ambitious targets. I think it was 2030 that would see significant reductions in new infections. Do you think we can get back on track, or are we pushing it out a little bit?
I think the discussions that were happening are really about saying we still need to, we cannot afford, we've pushed it to 2030, but we really cannot afford not to really refocus. So the turnaround plans that have come in are quite clear, where we are saying all of us, our strategies must be about getting back on track and really pushing ahead and ensuring that those targets are met. And I think the discussions around saying the role of our communities, at the end of the day, the truth is that this will be won on the ground. The role of leadership, taking charge on some of the challenging areas, like the infections in the young girls, the adolescent girls and young women, the issue of the role of integrating young boys in our programs, getting the men on board. So all those who have not been really focused, we refocus. We do believe it is possible. We do believe we have to rally. We have programs in the country where we've looked at how do we, what we call the new approach, the approaches of Operation Sugumasake, the district development models, which are about community and saying, how do we get our communities back? So the issue is more about really getting everybody on board and getting this back on the agenda, because Peter, the issue had really lost that to be on the agenda because of COVID. And it's really for us. And I think it's one of the objectives of this conference. It was saying COVID obviously really derailed us, but let's integrate it. Let's not look at COVID outside the other challenges that are there. Can we integrate it back in our responses so that we ensure that we don't win on COVID and then lose out on the other pandemics?
Yeah. All right, so I know that over time, the infection rates, you've managed to see an improvement in terms of decreasing, but there is this vulnerable group, young women and girls, that seem to be continuing on the upward scale. Is there a specific response just for that vulnerable group? Because sadly, they are the ones that are the future, but they seem to be the ones most vulnerable.
I think this is one area that, again, I would say it's not only just in South Africa, the sub-Sahara of Africa. In Africa, we are seeing that this is a group that is vulnerable. But our communities and our leaders need to realize that young women are not getting infected by themselves. If we have to win this war, the issue of sexual and reproductive health at the core of our young people, but also getting our young boys on board, because over time you want to have men who understand wrong is the issue of having these only responses targeting young women and forgetting the role of men into the response. But also more importantly, I think what was coming out in the conference is the issue of implementation. We do need to look at really deeper in our implementation. I think from a policy point, we might have the policies, the programs, but we now need to look at the quality of our programs, the monitoring of our programs, the measuring of their effectiveness, but ensuring that we get everyone on board in terms of that, and not just targeting young women on their own, because this does not happen outside the space of our society in general, where our young women are finding ourselves in this thing. So the issue of leadership coming on board, our communities, starting at home, in our homes, in our communities, our men, we are really urging them to be, and I think that was the discussion that is coming in, that we really need to turn it around, implementation.
All right, perhaps a final question, and one that we don't often talk about, or perhaps not often enough, is that there's the STIs portion of the discussions as well. What are we currently dealing with on the continent? Which kind of STIs present the biggest problems? And what is your response to how we move forward?
I think what is clear around the STIs are the different infections that comes in, whether we talk about gonorrhea or we talk about the herpes simplex virus, which is the ulcers or the discharges. That's how we would define them. And what we were looking at them is the approaches around their treatment and ensuring that we have effective treatment and effective approaches in terms of treating the STIs. But included, we must remember, syphilis is still there as well. But we are also there talking about prevention, because these are the STIs where if they are not prevented, they are the ones which predisposes to HIV as well, because you will get the STI and the HIV comes on board. So the effective treatment of the STIs and the clinical approaches around that is important. And I think it came out quite clearly, and those were discussed. And we are still saying the prevention approaches, the use of condoms still comes on at the top. But people also understanding that once they have STIs, they need to be treated. And once they are treated, their partners must be treated. Those still remain on the agenda. And the clinical and the drug, the type of medicines that we use to treat the STIs as an approach of ensuring that our treatment is effective. I think that is an area that came out strongly in our discussions, and that we still need to communicate. STIs are there. So it's not just HIV, but the other sexually transmitted infections are still there. We need to protect ourselves. We need to treat them effectively. Sure, we take the medication once those approaches that we discuss clinically are being used. And that is important, Peter, as part and parcel of managing our HIV program.
Dr. Ndlovu, thank you so much for giving us a wrap-up of this very, very important gathering that you've just finished. And thank you so much for your time.
Thank you very much, Peter, and thank you very much to the listeners at home.